Before I start talking about the issues of mental health and mental illness, I wanted to give this definition, these two definitions up here, because sometimes I think in the Hmong community we use the word mental health, and what I've found is that sometimes folks think that that just means the same as mental illness, and it's not. And so Wikipedia's definition of mental health basically says that it's either a level of cognitive or emotional well-being or an absence of a mental disorder. So mental health just means exactly that, that you are healthy in terms of your mental functioning. You are you don't have any sort of dysfunction that would fall into the clinical range. And then mental illness, of course, is a psychological or behavioral pattern that occurs in an individual and is thought to cause distress or disability that is not expected as part of normal development or culture. So anything that is based on your mood, your thought patterns, your behaviors that is above what most people would consider to be socially appropriate or socially acceptable, what most people call as normal within that culture, then that would fall under mental illness. And we were having a discussion earlier before you all came about how many years ago homosexuality fell into that category of mental illness, because at the time the culture itself felt that anybody who was interested in same-sex relationships were abnormal and fell within this category as mental illness. Of course, we now know that that is not a mental disorder. It is rather a sexual preference, and so that is no longer considered a mental illness. But that is a really good example of how a culture can define mental illness. And so that's going to be really important for us to keep in mind as we talk about mental illness and the disorders, and how it's conceptualized in Western culture and how it's conceptualized in Hmong culture. And I think that's pretty much the most challenging piece for all of us here, is that we're not giving a message to a Western person, or a person who ascribes to the Western culture, but where the CD compilation is actually going to be disseminated to individuals who may still be very traditional in their in the way that they think in terms of the Hmong culture. And so we're gonna have to try to figure out a way to navigate that in a way that's culturally sensitive and culturally appropriate. Now, you know, some of the challenges in my work is that there are often too few words in the Hmong vocabulary, in the Hmong language, to explain truly and capture the intent of a Western terminology. And there are a lot of Western terminologies that describe mental illness and the disorders. And yet when you translate or when you interpret over into Hmong, it's confusing, sometimes it's vague, sometimes it doesn't truly capture what it is. And so what I've noticed is that when we talk about mental illness, like I said before, people often think mental health, and then people often think it's depression, because there is no word to capture mental illness. And so we just say "genyoshia," or we just say "munjitu tamonyoshia," but that's not all that it is. But if you think about it from just a general community perspective, when people think of mental illness, they first think of depression, because that is the word that we often use. And then even among the word depression itself, it's very confusing and challenging, because depression in Hmong could be genyoshia, but then what about anxiety? And then what about mood disorders? And so anxiety is a lot easier to differentiate, because you can say no. But then when you think about mood disorders just mean emotional difficulties. And what do you say about that? Genyoshia again, right? And so it gets to be very confusing. And you know, what we find is that these words in Hmong can be best understood within its context, meaning that if I use certain words to elaborate on it, then it's easier to understand. So, for example, anxiety, if I say, then you kind of know, okay, it's trauma, or you know, it's trauma related to the accident. But oh, nuôi mà của cháu hành lý à của nhau chạy của chơi cháu hay điều ở nhà wow ở nhà chỉ muốn tiếng nhau chạy lệ yo, and so then it becomes anxiety, and so you see that it's within the context of the conversation that you can really capture what the intent is, but if you just throw out a vocabulary word out there, it doesn't really capture what we mean in Hmong. Now, when I talked a little bit about what we think of mental illness and I say it's depression, it really isn't. It is a lot broader than that. Mental illness includes mood disorders, which is probably the most common that people think about in the community. And I put in there adjustment disorders too. So among the mood disorders, we have major depressive disorder. And that pretty much is someone who maybe has difficulty sleeping. They either can't fall asleep, they're sleeping too much, they have loss of appetite, they may worry, they may have low motivation, no energy, don't want to hang out with friends anymore, just wants to stay at home all the time, can't even get themselves dressed, can't even get themselves to school. They're just really lethargic, thinking about suicide, just not wanting to live all the time at all. And so those people would fall into that major depressive disorder. Now we have, of course, the generalized anxiety disorder, which is someone who worries constantly about little things, and they just can't get themselves to not worry about things. So, for example, someone would worry about, there's a snowstorm coming. What if so-and-so came home, and what if there was an accident? What if they died? And then what would I do? And it's just worrying about things that most people would not worry about. Taking things to the extreme would be folks who have a generalized anxiety disorder. Of course, we have the post-traumatic stress disorder, which are folks who have been exposed to some very traumatic situation. It could be, of course, someone who's been in the war. Our military service folks who are in the war could be suffering from post-traumatic because of having been exposed to gunfire. Of course, our parents and our grandparents may be suffering from post-traumatic because of having been exposed to the Vietnam War and having seen family members die right in front of their eyes, or just having seen bodies as they were fleeing from their homeland to Thailand. And some of those symptoms could be nightmares, flashbacks, sweating, unable to think, poor concentration. And so not one symptom falls into it, and certainly this is not a session for you guys to diagnose, but I want you guys to get a good sense of what some of these symptoms are and be thinking about how this applies to our Hmong community as well too. Not only with our young generation, but also with our parents and grandparents. And then of course the obsessive compulsive disorder are the ones where the person is unable to let things go, very rigid thinking, needing to do things, have things just so, checking and double checking things, just having a difficulty to trust that things are okay. If you guys, I know some of you are very young, so you may not have seen the movie As Good as It Gets, where Jack Nicholson is checking and double checking the doorknobs because he's got this condition we call OCD. And then of course we have the adjustment disorders, which is very common for folks who may be adjusting to some new situation. So let's say you've just came from Thailand and you're adjusting to this culture and you're adjusting to the language piece of it, and you're very depressed because you can't find a job, you're very depressed because you can't drive, it's just a whole different world, then that could be falling under the adjustment disorder.